Thank you all for being here. It's really heartening to see a sold-out, standing room only audience, considering especially what we're competing against. So it shows, it says something very, very positive about the folks here at this festival. I've got a script here, but we're not really going to follow it. We talked about that already, because these two already know each other. If you haven't read Tripp's book, you should. So I'm going to start by asking Tripp to talk a little bit about his book called The Tunnel and why he wrote it.
Thank you. So the book is really about my journey through the world of mental illness through my son, Henry Friedler, who was diagnosed bipolar and struggled for 10 years with that diagnosis until he ultimately took his own life in 2020. So for me to sort of try to work through my demons, if you will, or how I was going to sort of come to grips with this event that happened to me and my whole family, I started writing a book, and I started thinking I was going to write it. There's a poem which I always like to talk about. It's not really a poem. It's a short story by Kurt Vonnegut about with a conversation he had with Joe Heller. And he is at a mansion on Fire Island, and he's telling Joe Heller that the guy who owns this mansion made more that day than Joe Heller made his whole career in Catch-22. And Joe looks at Kurt and goes, well, that may be true, Kurt, but I have something he doesn't have. And Kurt Vonnegut goes, well, what do you have that he doesn't have? And Joe Heller goes, well, I have enough. And I was fascinated by that notion of enough, and maybe I could use my journey with Henry to somehow come to grips with that concept. And as I started writing, and for anyone who's in the room who's written anything, you know that once you start writing, the writing takes you where it wants it to go. And so this book became less about that and more about my family's journey through this unbelievable event that bestowed upon us. And so that's really how the book got written. That's why the book got written. And in the book, when you read the book, if you haven't read the book, one of the heroes in the book, and there aren't a lot, but one of the heroes in the book is Serena and her institute, which is a Tulane institute called the Early Psychosis Intervention Clinic. So now I'm going to let Serena tell you a little bit about her and her work.
That's a generous introduction. Hi, I'm Serena Chaudhry. I'm a clinical social worker by training, and I helped to found the Early Psychosis Intervention Clinic, EPIC NOLA. We have a clinic in Mid-City, and we see young people, typically between the ages of 16 and 25, upon their first episode of psychosis. And just for clarity, for those who don't know, psychosis is a break from reality, often represented by symptoms such as paranoia, delusional thoughts, auditory or visual hallucinations. So we see young people at this moment when their lives have been turned upside down, things get really, really confusing and scary. We see 60-some% of our patients after their first hospitalization in a psychiatric ward, and we bring their individuals in with their families, and we try and help them make sense of what's happened, educate them about what's happening, as well as their diagnosis and symptoms, and help solidify the ground they're standing on and move them into a place of stability and recovery. Coupled with our clinic, real quick, we have a psychosis early awareness campaign called CALM, Clear Answers to Louisiana Mental Health, and we really feel that our work is a two-pronged approach, both treatment and community awareness, and I'll talk more about that as the conversation evolves.
Thank you both. Tripp, I'm not going to quite follow this script. If you've read the book, you know that
I can handle
Tripp,
you, Clancy.
What's that?
I think I can handle anything you got for me.
We'll see. No, but Tripp and I are old friends, in case you can't tell. In fact, my youngest son, Will, was friends with Henry. They palled up over in Florida when we happened to bump into Tripp and Heidi. Margot and I have known them for decades, and turns out we had sons the same age. They were like 5 years old or 4 years
Right,
old, and
yeah, they were young.
they kind of grew up being pals in Florida during summer vacations. You pull no punches on yourself in the book and your own limitations and notions as a parent. And you also pull no punches on society and the mental health network. And you were somebody with resources. You could afford pretty much any clinic in the country, and you still had struggles. Talk about those two.
Yeah. So
those two things.
So we have a family saying, which is that if you have the money for the solution, you don't have a problem. Turns out there are some things that there's just no money for the solution, and this was one of them. It breaks my heart to know that everything we did, we could afford. We were lucky. It didn't matter at the end of the day, but it enabled me to be able to know that I did everything I could to affect a different outcome. The interesting thing that I had to come to grips with, and I wouldn't say I'm hard on myself in the book. What I would say is I'm honest in the book, because anyone who's experienced a major loss in their life, it's one thing for the world to tell you, you did everything you could, but if you're a parent or you lose someone that's really close, that doesn't do you any good. The brain may know it, but the heart, that's not what the heart feels. And so, you go through and you think, well, if I'd have done this, or if I'd have done that, or if this could have happened, or if that could have happened. And what I ultimately came to grips with was two things are true at the same time. You can do the best you can, and it cannot be enough. And you're just going to have to sort of get comfortable with that, because you never give up. One of the things I talk about in the book, that, this notion of tough love, right? This notion of, someone struggling, and are you really helping by providing resources or doing things? And this notion of, well, what really needs to happen is some tough love, right? You need to just cut this off. And I don't care if it's, bipolar disorder, schizophrenia, drug addiction. It doesn't matter which form of mental illness we're talking about. You reach a point where society tells you, or your friends tell you, or professionals tell you, you need to cut that off. Well, that's easier said than done. No parent, and this I'm 100% sure of, no parent will watch their child drown. Just won't happen. You're not going to do that. However, what does happen is you get so exhausted and so tired and so just at your end that you don't know what to do, right? And so that, I don't call that tough love, I call that exhaustion. And when you get that exhausted, then, you let things go where they're going to go. And, I'd really love to hear Serena's take on this, because she helped us through some of that. The one thing, too, I want to say before I get yours is the other issue that I had, which is in the book, is my wife can justify this. Probably anyone who knows me can justify this. I'm a wee bit of a control freak. And I like to feel like everything, I have control over everything. And even during the worst of it, I'm sitting here trying to control situations and trying to control how things are going to happen. And that is a fallacy, because you have no control. And Serena helped us understand that. So I'd love to hear your opinion on all that.
Yeah, so I met Tripp and Heidi towards the end of their journey. And I think the first thing I want to comment on, for those of you who have read the book, maybe you can think back to these moments. For those of you who hadn't, this isn't a big spoiler alert. The community failed Henry and Heidi and Tripp. The community failed them and their family, and our systems failed them. And that is, I think, a huge takeaway from this book. We all need to do better, and that's why I'm here today. We need to understand what psychosis is, what chronic and severe mental illness is, how to recognize the symptoms, and how to reach out to people who are experiencing them and guide them into specialized care. We know that early intervention works, and if young people come into treatment early, they can get back to living their lives relatively symptom-free, and they can live happy and healthy lives. We have patients who are going to law school, who are working abroad, who are having babies. These illnesses that many of us knew at another point in time to be sort of life sentences, they don't have to be. And that's, when I was reading the book, that was the hardest part for me, to see the very clear moments when we failed. So I'm so excited y'all are here. I'm so excited to see young people here learn to listen and learn and understand what mental illness is. The other thing, and I think you talk about this every time we've talked, and you mention it in the book, like, ask friends how their kids are doing. Don't be afraid to be uncomfortable with the uncomfortable. If you have a friend, family member, anyone who's struggling with a mental illness, you reaching out does so much for them. People are left isolated, ashamed, and isolated by stigma. And there's so much stigma out there, and that's what we at Calm are trying to do, just facilitate, engage in these conversations so that we can say the word psychosis, we can say mental illness, so that your best friend can admit to you that their kid is struggling and hearing voices, and they don't have to feel ashamed, and you don't have to judge them.
And I'm gonna pipe in just to keep you from talking.
It's always a good thing.
Right. To sort of piggyback onto that, I want to make sort of 2 points. One is, if Henry was still alive, I couldn't have written that book. One of the interesting things when you have someone in your family struggling with, and it doesn't matter really what they're struggling with, there's a laundry list of things they could be struggling with, but when someone is struggling, and I mean really struggling, you got to understand it's two people's stories. Mm-hmm. So it's not just my story, right? I have my story, Henry's sisters had their stories, and Henry has his story, and it's a fine line between telling someone else's story, right? Especially in the world we live in, when that story is going to have repercussions on the kid. Because we do not live in a society that treats mentally ill people well. And, there's a stigma. I say this all the time. If Henry had had cancer, people would bring us casseroles. No one's bringing casseroles for someone with bipolar disorder. It's a stigma that should not exist. I hope it eventually doesn't exist. Maybe with more stuff like this, it won't exist. But it clearly exists. So when Henry went back to Millsaps and had a great year, I didn't tell anyone he had bipolar disorder, because if I'd have told people, they would have treated him differently. And that's a shame. That's a shame. And so it is important to find a community. It took us a very, very, very long time. But I will say that even with close friends, and I want to call out one of my friends, we had to talk about this just this morning, who has a friend going through one of their kids is going through really hard times. And they're frustrated because they're trying to be there, but the friend won't admit there's a problem. And at some point, it would have been nice to have a community because we have great friends, many are here, who would have been there had they known. It's an easy thing to say, go get help, go ask for help. It's so much harder to do. And you just have to trust that, you just have to trust that you just have to have some trust, and you just have to let go a little bit, and you just have to realize that if the world doesn't understand, that's not about you. That's about them. And so you just need to somehow get through it. And if I could have, if I had my wishes, this wouldn't have happened to me, right? If I had my wishes, when all my children were born, 10 fingers, 10 toes, walk, talk, played, everything was good until it wasn't. And so it's the horrible part was the getting of the disease, right? And then the second horrible part is the fact that society just creates you as a pariah, right? There's no help for you. And luckily, one of Henry's hospital stays happened to be in a wing that Tulane ran. And so he got to meet Dr. Weiss. And I always have problems with that. He got Ashley. And he got to meet Dr. Weiss, and through that we met Serena and the whole program. But that's luck. Because if we'd have gotten put in a different ward.
Yeah, it's luck, and it shouldn't be luck,
It
right?
shouldn't be luck.
We've existed in this city for 10 years, and we help, young people.
Just like Henry.
Just like Henry, and they came to us, Henry came to us towards the end. And so it's how do we, I think this is a challenge for the US at large and New Orleans in particular, how do we better collaborate as service providers? How do we talk to each other? How do we work across institutions and share resources and information to get people into treatment when they need to get into treatment, which is early?
Well, I interviewed Tripp several times for a cover story in Gambit when the book came out, and we did a Q&A. And Tripp said something that, in my experience as a journalist, when somebody says something that really nails it, it kind of jumps out at you. And what he said was something that Serena just mentioned, and we made it the headline of the Q&A. We all need to get comfortable with being uncomfortable. And that's what he's talking about there.
Yeah.
I don't know if you want to add it, because
Yeah,
you had
no,
two
it's-
things. I think that was the second thing you
Right.
wanted to
Yeah, no,
talk about.
it's so, two things happen with us. The number one is Henry got the disease, and the number two is the disease killed him. So, in the book, because we went through this range of stuff, right, the book talks a little bit about grief, right, and about how to deal with people who are going through grief. And, one of the things that I think is important, especially on that side, because I can just tell you right now, if anyone's going through something and they lose, there's a death of a loved one of any kind, there's nothing you're going to say that's going to make that better. We'll just put that out there right now. There is literally nothing you can say that can make that better. What you can do is be comfortable in that uncomfortableness, because it is very uncomfortable. Like I'm sure many people in this room have been in rooms with people who have lost people, and there's nothing you're going to say, but being in that room is huge. And so just being comfortable with being uncomfortable is the only thing I can say that really resonates and really, is probably the truest thing you can do. I mean, just being Brian Stevenson yesterday, if you were lucky enough to go hear him, he talked about proximity, right? It really struck me because he was talking about impoverished people and incarcerated people, and just being proximate to those people is half the battle. And I think the same's true with mental illness. If you're willing to just be proximate, right, be there, be uncomfortable, because it is uncomfortable. If you're able to just do that, that's 3/4 of it. Maybe 90% of it.
Yeah, we were talking about this just earlier, and in that proximity, ask yourself the question of what this person might be going through, try and withhold the judgment, right? This person is someone's son, this is someone's daughter, this is someone's brother or sister, right? They're a human who's struggling in this world. And I think if each of us can pull back a layer of that judgment in these moments, we will be moving in the direction of reducing stigma. And stigma is a barrier to young people getting the help they need, and it's the barrier to families reaching out too.
Yeah, I mean, I was telling Serena the story, and I was over at NAMI telling them the story. I saw this young man in serious distress, clearly going through a bad time, living in the park, I believe, because I've seen him in the park. And every time I see something like that, every single time, I think of Henry. Every time. And so I just put on that face, right? And to me, he's my son, right? And a part of me wants to go up and say, "Are you okay?" Another part of me knows that sometimes probably isn't the best thing to do. But certainly the thing to do is not to just write him off, right? Not to just walk across the street and go, "Oh, God, I don't want anything to do with that." I'm not saying you go up and give him a hug and see what's going on, but I also wish that people would just have a little more empathy. I was noticing I was talking to a friend, and he was in the park, and he was on the bridge going, over to the golf course side if you walk around the park, and sort of in the middle, right? Clearly in the middle. And wasn't saying anything, just sitting there. And my friend I was talking to had to go, and I said, "Are you okay?" She goes, "Yeah, she goes, I'm fine." But I saw another woman walking a dog, and she was going to go that way, and she turned around and went a different way. And this kid wasn't going to hurt anybody. I mean, it just wasn't going to happen. But that stigma is so strong, and societally, we have to somehow get past this, or it's always ironic to me, and I don't want to get very political because you could go across the street if you want to get political. But I will say that every time there's some mass shooting, it's never the guns, right? Mm-hmm. It's always mental illness. And we shouldn't give guns to people with mental illness, though, by the way, you can't keep a gun out of the hands of someone with mental illness. Good luck trying to do that, even though that's what they say they want to do. That's impossible. There's a woman I've met through this who wants a law to just say, if you want to not have a gun, you can sign up on a list. We can't even get that law passed. So, this notion of, it's not guns is a whole nother subject. But the fact of the matter is that we just don't, as a society, we just don't seem, we say, let's deal with mental illness, but we don't want to put any money behind mental illness. We don't want to provide any services behind mental illness. If it wasn't for the, Obamacare, we wouldn't even cover mental illness. So it's just society says one thing, but does another. And it's like with your kids, do as I say, not as I do, but they're looking at what you do. And what you do is so much more important than what you say. And as a society, we might say these things, but we don't do these things. And so that's a whole nother mess that, I've trying my best, and I just had conversations with someone in Chicago who wants me to go to D.C. and talk to some Congress people, which I will do, because what is atypical, I guess, in writing this book is there aren't many white, successful businessmen writing books about their struggles with their family who suffers through bipolar disorder. And so I can go up to the Hill or go to Congress or go talk to people, and they just can't write me off the way they write some other people off. They shouldn't be writing anyone off. But I have a platform that others don't necessarily have, and I'm committed to using that platform to try to change things. But I can tell you, it's a monumental task. And as a society, the first step is to quit judging. You know, just, you know, you've always heard your parents say, don't judge a book by the cover. It's true. You know, you can't judge. You don't know what's in people's hearts. You don't know anything. You don't know where they came from. You don't know what their life was like. You just don't know anything. And so ask, don't judge. That's what I would say.
This leads into, Serena, you want to talk about how universal this, you know, how, go ahead.
Yeah, well, I think you're using your social capital, and I appreciate that, to advocate. And that's what everyone in this room is here because there's an interest, and you all have some social capital being here. So I encourage you to leave here and share the book with people, encourage people to read them, talk about serious mental illness, ask someone the next time you see someone suffering. But what Clancy asked me to talk about is the prevalence of this. 3 out of 100 people will experience psychosis over the course of their lifetime. That's real, and that impacts people in this room. And serious mental illness doesn't discriminate, and we would all like to believe that we are immune to this. And Tripp and Heidi are living. They show us that this doesn't discriminate. And there are others in this room, too, who have stepped up to advocate. And I am so inspired by y'all for talking out, for engaging the community at large in this conversation. So that's one thing I wanted to say in answer to your question. And then you were talking about, how people are, how mental illness is portrayed in the media. And when we have these mass shootings and there's this violence, we talk about, the mental illness and not the guns. People with serious mental illness are more often the victims of crime than the perpetrators of crime, and that is not in the media, and that is fact. And so we need to flip the script and help people understand who really is vulnerable here.
You know, again, I'm going to talk about Brian Stevenson, who's, if you haven't read his book, rush out and go get it. It's an amazing book. We're just so eager to judge. I don't understand why. And so
we're uncomfortable.
Yeah, we're uncomfortable.
It's a coping mechanism,
Yeah.
I think.
Yeah, well, it's what is interesting, which I did write about in the book, is I had the opportunity one time to talk. One of my friend's son-in-law is a fighter pilot in the Navy. And he, you know, when you talk to him, or you talk to any pilot, major pilot, any plane accident is never the pilot's fault. Like, it's always the pilot's fault. If any accident, if you talk to another pilot, it's the pilot's fault. Both wings and all the engines can fall off, and that's the pilot's fault. He should have checked that plane before he went up there. And if you think about being a pilot, you need to have that, right? Because you want to believe that you can control whatever goes wrong. And so anyone else who dies, it was pilot error, right? Because it never would have happened to me. Well, parents are the same way. Mm-hmm. And there's some empathy I have because, when parents judge, what really is going on, whether they know it or not, what's really going on is this notion of, well, that can't happen to me because I'm a good parent. Well, I can tell you, because we have 2 other girls who feel like they had good parents, that's bull, right? It can happen to anyone. And it has nothing to do with that. Now, clearly, there are some bad parents. Many of them you see on the evening news. But the fact of the matter is that I felt judged often. Mm-hmm. But and at first it really did piss me off. I mean, it made me very upset, to be honest with you. It made Heidi, my wife, even more upset. But the fact of the matter is that they're struggling and they're doing the best they can, and this is what they need to do to cope, right? Because if you believe that if you work real hard, it can't happen to you, then that helps you get through life. And God bless you, and I hope it doesn't happen. And you can always think that it was because of your incredible parenting skills. Mm-hmm. But I'm here to tell you that is luck of the draw. And you do the best we can. And I'm just going to say one last thing, because it's sort of on a lighter note. To this day, I always tell my girls that the two things I'll pay for is their health club, because I want them to be physically in good shape, and their therapists, because I caused it. And so the fact, I remember I went back to school to get a master's in counseling just because I was interested in it. And the first class was Intro to Counseling, and we had a guest counselor in, and I remember asking, he was talking, and I remember asking him a question. I said, so basically, is there anything we can do that when our kids get older, they're not in therapy blaming us? And he goes, no, nothing. and so the fact of the matter is you just do the best you can. And most of the time, it's good enough. But sometimes it's not. And you just have to reconcile your head around the fact that two things can be true that are totally opposite.
Yeah.
So
I was thinking about parenting and the challenge of it, and I think one thing that hasn't historically been done with comfort, because it's uncomfortable, is within our family systems talking about a history of mental illness, knowing what the history is within your family and talking about the risks. If there's, I'm going to speak from the perspective of psychotic disorders, if there's a history of psychotic disorders, your kids have a higher risk of that, and they should just know that. And there's some vulnerabilities they have. Smoking weed, not a good idea. They're vulnerable to developing a psychotic episode. But we have to be talking about these things in order to acknowledge that they exist, to reduce the stigma, but to educate our kids so that they know what they can and can't do or should and shouldn't do. And then if something happens, that it's worth reaching out to you to get help.
yeah, one of the interesting things that I talk about in the book is so I'm a big, when I went back to get the master's, though, my wife's in the room, so I'm going to caveat the fact that I did not do my practicum, so I did not get my master's. But I did take all the coursework. And one of the courses we studied was a guy named Bowen, who wrote something called Family Systems Theory, which is about systems theory and homeostasis. I could go on and on about that. It's a fascinating topic. But all families have methods of dealing with anxiety. In my family, if you could be successful, you got yourself right out of the maelstrom, right? You were good. And if you weren't, then God help you. So my brother, who is not successful, who is crazily successful now, but wasn't growing up, he became a heroin addict. And so, but me, I went to Exeter Prep School, Amherst College, Tulane, did all the things right, good athlete. And so I hovered above. I believe strongly that family systems theory was something that was not helpful to Henry, right? Now, again, for most of my life, until I went back to get that master's that I didn't get, I was
Failure.
Yeah. I don't want anyone going back saying that Tripp has a master's in counseling. But when I went back to get that, that's when I learned, so one of the things that Andre Stern told me, who's my therapist, who I love, said, imagine your dad is 6 feet tall, and there's an 8-foot tall wall, brick wall, solid brick wall, right? And his nose is right up against it, and you're on his shoulders. And you're looking out at this amazing landscape, like just so beautiful. It's just beautiful. And you look down to your dad and you said, how come you never told me about this? Well, he can't see it. I mean, that wall's 8 feet tall. He's 6 feet tall. We only can see it because we stand on their shoulders, and we can't punish people for skills they don't have, right? And so you just have to do the best you can, and then you learn more. And sometimes you learn these skills in a really horrible way, which is the way I had to learn some of them. But the fact of the matter is that you can do the best you can. If there's any message I want to get out here, it's that you can do the best you can, and it cannot be enough. And you're just going to have to learn to live with that. And so otherwise it will eat you from the inside out. And that's not helpful to anybody. So forgive yourself, you know, number one, and, you know, and just keep on keeping on doing the best you can do, and hope it's going to be good enough, and realize that maybe it won't be. I mean, poor Serena sees 20 of me every day. You know, I mean, I tell people all the time, if you read the book, you'll understand, because Heidi and I, and Patty and Kate, well, Patty escaped for the most part. She got to go to college. But, you know, Heidi and I and Kate lived in total chaos, like total chaos. And anyone in this room who has kids, and I've seen a few who I know because of the book, whose kids struggle, they understand what that chaos is like. And that chaos is no fun. So I miss my son terribly, horribly. I think about him all the time. Next week, he would have been 32. But I don't miss the chaos. I don't miss the chaos. And that's hard to get your head around, right? I mean, that's hard to get your head around. So it's just, I have so much empathy for anyone going through any of this stuff, because it is just hard, you know. But you know, sometimes life is hard. There's a great book by Viktor Frankl, who, if any of you haven't read it, called Man's Search for Meaning. And if you want to see someone who had a hard life, read his story. You know, here's a man who was a preeminent psychiatrist in Nazi Germany, you know, gets thrown in a concentration camp and literally loses everybody in his life. Everybody. They all die. He lives. And he's optimistic. So there you go. I mean, we all want to think that we can overcome. None of us want to get tested. I mean, certainly not the way we got Heidi and I got tested. No one wants those tests. But there is something to overcoming, right? There is something to getting through, and there is a lesson to be learned there. And so, you know, it's a privilege to be challenged and to be able to be to rise above. I view it as a privilege. I mean, not everyone feels the way I feel, but I just think that life is going to throw at you a lot of things. You know, I look at these young kids over here, and life is going to throw at them all kinds of things. And you just have to do the best you can and keep moving forward and put one foot in front of the other, and understand that at the end of the day, all you can do is the best you can do.
The best you can do, and reach out for help. Like, you don't have to do it alone.
Yeah,
and
you don't have to do it.
That's a huge takeaway from this journey too.
And Serena's right. Find a community, because if you try to do it alone, that will eat you up as well. It's just too hard, quite honestly. It's too hard, and there is help. This is living proof. And I used to say, I did a talk with a woman named Meg Kissinger, who wrote a incredibly great book called While You Were Out, which is, if you think it's hard having mental health issues in 2025, think what it's like in 1975. And so her book was written in the 70s, and we were talking, and it's just, you have to find that community, and it exists. And I used to say there's no billboard saying find help here, but now there are billboards saying find help here, because I've seen calm billboards. So, which is amazing.
Let's let Serena talk a little bit about the work that she does some more.
Yeah, so I think...
Wait, I don't get to talk all the time?
No. But that's a good segue about these billboards. I mean, part of what we're doing to try and destigmatize is putting the word psychosis out there, putting severe mental illness out there, putting the message that if you have a family history of psychosis, you are at risk. So I challenge you, I don't know that there are billboards up now, but there's going to be a new campaign coming out within the next couple of months that speaks to that purport these messages is a way of destigmatizing them. We have bus ads. We also, for those of you who might have someone in your life who is struggling, we on our website, calmnola.org, we have a quiz, and an individual can take that quiz, or you as a caregiver, friend, someone who cares about this young person can take the quiz. It can help identify what the risks are, and then it gives you or the individual taking the quiz the opportunity to connect with me, I'm the person behind the quiz, to then reach out for help, and then we can assess whether we're the right place or we can try and direct people to the right place. So there are resources out there. We have a podcast that we've just started. Tripp was a guest on it, and it's called Reality Check. Psychosis is real, so is recovery. It's a place and space where we're bringing lots of different people into the conversation about psychosis and severe mental illness. If anyone's interested in coming on the podcast, see me after this. But we're really just trying to engage the community, right? Because we all, as I said in the beginning, have a responsibility. Coaches, teachers, counselors, nurses, doctors, OB-GYNs, like all of you have a job. If you see something, you need to ask about it and then help a young person find their way into help.
And just
We have time for one more question, but I want Tripp to talk about this. The title of your book, The Tunnel, is a beautiful metaphor on several levels. Talk about...
Yeah, I will. And I just want to also say, if you do buy the book, a lot of the money's going right here. So all the money's going to mental health organizations, but a big chunk of it's going over to Tulane and the EPIC program. So for those of you who have ever driven from New Orleans to Florida and gone through the Mobile Tunnel, you'll know, I don't know if anyone, we were always told that if you could hold your breath through a tunnel, you get to make a wish, right? At least maybe that's what my parents told us when we were going through the tunnel.
We're trying to shut you up.
Yeah, they got 1 minute. They got 1 minute of silence. But anyway, so I always knew that as a kid, and we would go to, that was where our vacations were. We would go to the Gulf Coast on Florida and the Gulf, the Gulf of America. Anyway, we would go through the Mobile Tunnel, and we were always told if you hold your breath. So once Henry got sick, I started holding my breath, and my only wish was Henry would get better, right? And every time. To this day, and I go to Florida a bunch because we have a house over there, to this day, like Heidi, I'll be on the phone with Heidi or I'll be on the phone with someone, I'll say, wait, I got to get off, I got to hold my breath, because I try to hold my breath through the tunnel. And I don't wish for anything anymore. It's just my way of remembering my son. So the tunnel for me was a great metaphor, not just for that, but also, you know, you do get out of a tunnel, right? There is light at the end of the tunnel. I say in the book, you know, for Henry, his tunnel was a little long. He just couldn't get out. But we do get out of tunnels for the most part, and there's light at the end. And so I just thought the tunnel was a great analogy for my experience and our family's experience. Unfortunately, not so much Henry's. He ended up not being able to get out. But it is that great analogy, and to this day, and I say that some tunnels, like if anyone has ever driven from Denver, we go to Copper Mountain, but Vail, anywhere, that Eisenhower tunnel, no one's holding their breath through that Eisenhower. I don't even try. The first time I went through, I tried, and like after about, you know, a mile, I'm like, this isn't gonna work. And then, but on that same path, there's a teeny little tunnel, it's like 100 yards, and so in the book, I say some tunnels, like if it's 100 yards, that's cheating, right? You don't get a wish for, you know, a 10-second hold. But that Mobile tunnel, that's the perfect tunnel, because it's not easy, even with no traffic. With traffic, it's really hard. Mm-hmm. And if you see a bunch of red lights, it's probably not happening. And just as an aside, on the last time I went through, I was wondering if you breathed in. I didn't breathe out, if that counts, because I took a little, or what happened was I breathed out but did not breathe in, and I was debating, because it was really long, there was a lot of traffic, and I was debating on whether that counted or not.
Only you could have a debate about that, Tripp, but congratulations. Thank you all for your kind attention, and please buy the book and read it, and share it.